case note discussion for Sally McNoville. And so we'll see first what is actually, as soon as you got your case note with you, so what you're going to do is you're going to check what is important, that is our writing task. Okay, using the information given in the case notes, write a letter of referral. Okay, it's clearly mentioned it is a referral letter. Okay, so we got one point to the admitting officer at the emergency department. So it is something very, very important. That is, it is an urgent letter. Okay, emergency department, Newtown Hospital. So the question arising from here it is, so why it is emergency, urgent? Yeah. So why it is? So you can look that just above the date, the time and date of just above the discharge, the writing task, you can see the important points. You can read this one and we'll go back and start from the beginning, so you can find out why we are writing it is an urgent letter. So we don't know anything about the patient, so why the patient is need an urgent emergency department admission soon. Yeah. Okay, so 13th 9 2014 10 a.m. History, more short of breath. So definitely, so it is says short of breath. Okay, despite prednisolone antibiotics, whatever, yeah, it's still more short of breath. So it was previously it was less, now it is increased. You can see that it increased, so the more is there. Yeah. So okay, so that is the, so despite prednisolone and antibiotics, there are medication history has to be there, so that you need to aware of that one later. Feeling feverish and unwell. Okay, so if patient has got fever and his patient is not at all well. Okay, so examination, short of breath at rest, respiratory rate is 25, obvious accessory muscle use and increased work of breathing. Pulse rate is 112, blood pressure is 165, temperature is 37.7. Chest examination, then widespread V's and bibasal crepitations found. Okay, so these things is the observations, and which is important is that is important. Okay, so assessment, acute asthma or coronary pneumonia. Patient got a coronary pneumonia, that is called coronary pneumonia. So you need to we need to find out whether it is pneumonia or not, but at present patient has got acute asthma. Okay, treatment, so ventrolinibule salbutamol 5 milligram reviews as given, and at 10:45 no improvement, still obvious respiratory distress, so refer to emergency department for acute management and investigation, suggestive of pneumonia. Okay, so why we are referring? Because for acute management and investigate whether the patient have the suggestive diagnosis or probable diagnosis of pneumonia. Okay, we want we want a definitive diagnosis of pneumonia, so we need an investigation and the management according to that. So we need to send that patient to the hospital. Okay, to the emergency department. So then before that, then we'll go and see what's the history of the patient. Patient name is Sally McNoville, and age is 38, administrator single, and past history is asthma already is there. So we are looking for all which is important and related to our patient's condition, that is asthma, hypertension, cholecystectomy, ankle fracture, depression, non-smoker, and medications. Patient is currently on Ramipril. Okay, so that's to hypertension. So you can just see that, you can correlate that to, yeah. So paroxetine 20 milligram daily, cholecystectomy, and fluticasone to 250 milligram, and 2 puffs. That's a puff, yeah. That's already there's a and ventrolinase puff is there already inhaler, because the patient got asthma, so no allergies. Yeah, so that this whole history. So what happened means the patient's history is coming to you on 10/9/14 to you. A history, 2-day history of runny nose and cough, productive cough with yellow sputum, slight fever, wheezy, but not short of breath. Asthma usually well controlled on preventer, that is fluticasone. So you got a preventer, and so preventer is fluticasone. So usually that is she will get better with this fluticasone, yeah, steroid one. And examination, temperature is high, again blood pressure and all that baseline observations are done. No increased work of breathing, increased work of breathing, no accessory muscle used at that time. So your first initial assessment, viral upper respiratory tract infection, maybe, yeah, infective exacerbation of asthma. This is your assessment, and your treatment is again ventrolin puff. That was 2 puffs if required. It was previously if required. Now it is, yeah, yeah, means whenever necessary, but now it is 2 puffs 4 hourly. Continue preventer, still with preventer. Okay, medical certificate for work and review as required. So that's done. On that day, patients just reviewed, maybe you were in a clinic, so definitely you works in a clinic and patient came to you on that day. These are all the symptoms. Okay, so on 12th of 9, after 2 days, patient came back, increased shortness of breath, wheeze, again all exacerbated symptoms. Yeah, symptoms is, yeah, it's exacerbated. That means it worsened the condition. Yeah, it increased, worsened. Yeah, examination, temperature is increased. You can see that blood pressure is still the same, but respiratory rate is it is going told to, yeah, now it is 16, and throat is red and ears normal, mildly increased work of breathing, just widespread wheeze, no crepitations at that time. And again, we started because we thought it's on assessment it's a viral upper respiratory tract infection, but on the first day we didn't start any antibiotic. So now we're going to start with an antibiotic for amoxicillin 500 milligram, yeah, 3 times daily with prednisolone tablets, yeah, and again continue with the ventrolin and the preventer fluticasone. Okay, so in addition to that, we added amoxicillin 500 mg and a prednisolone to 25 mg tablet. So then comes to the third visit that we already discussed, that patient symptom is again worsening. There is no improvement in condition. So despite prednisolone and antibiotics, feeling very unwell. So that means on a chest examination, widespread wheeze and bibasal crepitations presented. So there is a chance of pneumonia and acute asthma. So definitely we want a emergency admission. Okay, this is all about the case note. Yeah, so the case note is there. So what this is, we already read this case note, and what our next step is, we need to structure and plan. Yeah, structure. Before that, we need to case note. We need to see each one and look at each case note and find out whether it is relevant, irrelevant, or semi-relevant. Okay, we already discussed what are the relevant things, but still we need to omit which one is, yeah, so we need to omit, and it's all in there. Yeah, so we'll see. So the past history is important because the patients the receiving end, they don't have any idea about this patient. Okay, so we need to add past history about, but he can write it after you explained about the current condition of the patient, because this is an urgent situation. So you should write the presenting compliant, not the present and presenting that's the difference. There's a present compliant you need to write. Yeah, so that is present compliant. At the time of writing patient's condition, you need to start from last day to the the date that we discussed. So from here you have to write from 14th, so 13th of 9 2014, from what's happened on, yeah. So on that day to backwards, like this is the emergency. This is the time of writing is 10:45 a.m. You are going to write in 11 a.m. You are going to write a letter of urgent discharge this patient to referral to this patient to emergency department. So you're going to present this patient's conditions first instead of, so the first paragraph should be the presenting the important concerns is, yeah, on, yeah. So this is, so what all concerns here, then we will say the patient came to us, you can go back and tell the story later. So that while telling you the story, so you have to say that patient presented to me on 2 days before with history of runny nose and productive cough with slight fever. So patient was already on uh, preventers like fluticasone and salbutamol, 2 puffs if required. So still without with that one, the condition was worsening. Temperature was 37.5 and respiratory rate is 12, and there is a obvious nasal congestion and throat red is there. So that's why we thought it as a viral respiratory tract infection and infective exacerbation of asthma. So we advise to take Ventrol in 2 puffs 4 hourly. Continue to preventer along with fluticasone. So that's your second paragraph. First paragraph we thought about that one. So then again we can say, okay, on the following day the patient presented with exacerbated symptoms like shortening, increased shortness of breath. Um, then the temperature was again the vitals were checked, which is like temperature is 38 and respiratory rate is 16. So still a mildly increased work of breathing and just widespread wheeze and no crepitations present on that time. Okay, so therefore with infective exacerbation is symptoms worse, that we thought. So we started with antibiotics, amoxicillin 500 mg and prednisolone tablet. Okay, so this is a reverse kind of, like you have to going back um, from the worst condition to telling the story later. Okay, so how you're going to draft the introduction for this one? Okay, you forget about your letter. I'm just saying according to, yeah, yeah, fine, yeah, but you can see the yeah, yeah, no, even if it is, I didn't read your letter today, so just kept it like that. I want to, yeah. Mm-hmm. Mm-hmm. Yeah, okay. Yeah, fine. Yeah, fine. Okay, okay. That's fine. That's fine. We will come back to that last. Just let's do this one first. Yeah. So three important things while you are writing, the introduction. What we need to write in an introduction. So three important. Yep. Mhm. Okay, let's try here. Okay, let's try here. Okay, so sorry. Let's try. Okay. All right. Okay, so patient name is there, so you are going to refer. So how you want to write is how you usually do? How
I'm writing to refer Miss.
okay. I am writing to
I'm
refer.
writing
Okay, writing
refer Miss
to
name of the patient.
refer
This is
Miss X, yeah?
yes.
Yep.
Who who is deteriorating?
Who?
Who is deteriorating? Worsening her condition. Who is
Okay.
uh,
So what is the,
what
you
who
know,
has features of who has the features of acute exacerbation?
okay, so
Features.
here, you are writing to refer. That's referral letter. Okay. So, Miss X, then patient, what's the condition, presenting complaint, what we are thinking, what you are thinking patient got. You can see just above that. So the patient,
Pneumonia.
you are thinking the patient got pneumonia. Okay. So, so you can write, as you said, who has features, okay,
Uh,
suggesting, okay,
Pneumonia.
of pneumonia,
Yes.
pneumonia. Okay, we got that because we are
Yes.
directly going what you are thinking, the presenting complaint, what you are thinking, and the features of the patient, yeah, or who are
Okay.
suffering from acute exacerbation of breathing or whatever. Okay, so here, obvious respiratory distress is there, so you can say patient, you are think definitely you are thinking, huh? Features
Yes.
suggesting of pneumonia, okay, along with acute asthma, okay, along with acute asthma, yeah.
Yes.
Okay, so that's clear. What's your patient
One is
conditions?
this.
One is done. That means
Other
the,
is her condition is I mean
so
worsening.
what yeah,
Not
the,
also.
yeah, but you can write it later. Means what's obvious is that you said the patient's,
Because
yep.
because the condition why we are going to refer urgently, we should not mention the purpose that she is deteriorating because of this acute exacerbation with the pneumonia.
So that's what I'm
This requires
saying.
the treatment.
Yeah, it is needed. The urgency of letter is very, very important in this letter. Why I'm saying, you see, I am writing to refer Miss X, or who has features suggesting of pneumonia along with acute asthma. Okay, that's the condition of the patient. You already said the patient got a condition. This is an
Okay.
introduction that you are saying the
Yes.
patient got an acute asthma and suggestive of pneumonia. That means it's an urgent. And you are saying
Okay.
she requires urgent
Asthma.
attention.
Uh,
Okay,
only.
okay,
Yes.
urgent attention, or you can say urgent attention from your
Attention
center. Yeah, oh sorry,
for
yep, attention
for
from your
management.
center, your center, sorry, your center for
The
investigation.
management and
Yep,
management.
the investigation and management of, or follow up management, yeah, and follow up,
Yes.
follow up management, yeah. So how is it,
Okay.
is it
Yeah. It includes everything.
it includes everything. That means if you go structure your paragraph, or your introduction including all the informations that in a style of writing, then it is there, you can construct any introduction. So the important thing you need to mention that the urgency should be there in this case, yeah. And what we are
Yes.
expecting, why we are writing to refer, so that reference is there. Okay, and what is the patient's condition? The patient got acute asthma along with the suggestive of pneumonia. So that's why what she requires. So what is the purpose? What is the immediate purpose? She requires to investigate and do follow-up management. Yeah. So
Yes.
it's investigation. Yeah. So it's my, yeah. Oh, good. I didn't see that. Okay. Investigation and follow-up management, and it is urgent, that we already.
Can we omit? Can we omit your center? Can we omit your center? Can write requires your attention for investigation and follow-up management
Yeah.
or no? Because of the emergency department, that's the reason you wrote it. The admitting officer at the emergency department.
Yeah, like, it is, as soon as they read this, the recipient is going to read the introduction first,
Mm.
as soon as they receive the letter. So what from this one they are expecting you to do that? That means they got a picture of the patient itself. You think about the real situation, not about the the OET exam situation. When you think about the real situation itself, so you can understand that
Mm.
the reader will get a correct picture of the current situation of the patient and what they need to do. So even without going to the details, they can start investigations.
Yes.
Yeah. So they, okay, as soon as okay, it is pneumonia, what you usually say, okay, so go for all that, the chest x-rays, whatever. So a CT scan, what, that kind of thing. So they know what investigations for that. But according to this introduction itself, they can quickly start the patient's assessment and the investigation, and save the patient. So that's what we are meaning here. So this is an urgent letter. They will get an urgent attention according to your introduction. So if your introduction went wrong, or if it is too long, or if it is not included all the points, that is going to affect the whole letter. Yeah. So this includes every point, but it is not that much too bulky, but it is as simple as it, isn't it? So that's what we want. You can create different things. This is just, we are,
Yes.
the purpose, we just created it. But you can, while you are doing all, reading all this, you can definitely you are able to create definitely like this introductions. Yeah. So only three
Yes.
things that you should be very careful about why we are writing the letter. So that's an important, we are writing the letter because the patient got these features and requires the purpose is actually there requires an investigation and follow-up management. Okay. So that you should
Yes.
be mentioned in that one. So then, according to OET writing criteria, so evaluation criteria, after your introduction, then the next paragraph is immediately explaining the purpose you already
Yes.
mentioned. So then you are going to explain your purpose, why she need an
Yes.
investigation. So what's the history of the
Yes.
patients, what happened to this patient, that we will discuss in the following paragraph.
Yes.
Okay. So this is just we will look into your introduction in a bit time,
Okay.
in a few minutes time. Okay. So that's one
Yes.
thing. So then you are planning for the second. Okay, planning for your second one, that means the first paragraphs, what you're going to write in your first paragraph.
Yes.
So your first paragraph is going to be this, the replication of this important, the last date of admission, last date of visit, that 13th of 9 2014. Yeah. So this day you are writing, so you can write today. Okay.
Today.
Yes, because
Okay.
you are writing at 10:45. So see the time.
Yes.
So
Yes.
today you what's the patient, Miss X, okay, came with
Miss.
exacerbated, yeah, Miss, yeah, the name of the patient, then
Yes. Yes.
with exacerbated symptom of shortness of breath, okay, despite taking prednisolone and antibiotics. And on observations, condition is this and this, like, whilst shortness of breath is there, respiratory rate is that much. So only, temperature, abnormal things you should mention. Then come back to, on chest examination, widespread wheezing and bibasal crepitations were noted. Okay. So therefore what we are no improvement, still obvious respiratory, you don't need to write that one. So treatment, just ventrolin nebules 5 mg is given as salbutamol Stalin nebules is given. Then so we sending this patient to emergency for emergency admission because the patient's condition was that. That's why we are sending. Yeah. So that's the first paragraph. Then we will see, as we discussed above, like, as we discussed previously, like we are going to patient, presented on this day with.
So I can write from initially she presented by some even later paragraph and second paragraph.
You can initially, yeah, you can write initially she presented with 2 days history of runny nose, productive cough with a low sputum, slight fever, and she was already on all these medications because she had a past history of asthma, and she's on ramipril. You can write everything in that. Yeah. So then again you can write examination done. That's important. What are the abnormal things you found on that paragraph? Yeah. So the first day, then you thought it may be a viral respiratory infection, so what you advised to take, so you started ventrolin 2 puffs 4 hourly. So that means already patient was on ventrolin puffs when necessary. Now it is going to be regular one. So then continue the preventer. So that's what your first one. Then the second, the patient again presented me on this date. You can say after 2 days, you can mention like that. Patient presented to me with, yeah, visited me or presented me. Yeah. Okay. So that's all the words you can use. Yeah. So with the increased shortness of breath, so the conditions, then again assessment done, and the thought the patient's condition is maybe infective exacerbation of asthma with symptom worsening of infective exacerbation of asthma. Therefore we started amoxicillin 500 milligram were prescribed along with prednisolone 25 milligram. Okay. So that was.
So that's it means my last paragraph should be the first paragraph. The rest should be the.
Okay, so that we will see. I will come back. Go back to your letter. Yeah. Oh, good. Yeah. So the case note. This you understand this. The structuring, what we are discussing, what should be going to your mind. Then